Understanding of the jaw rotation mean that whenever your jaw is being growing, it's not like that it's increasing its size from all the direction and dimension. It's like this, that whenever the jaw is increasing its size, the inner part of the bone is moving and rotating as well. What happened when your maxilla and mandible is growing? It's not only just increasing in all the dimension, is either moving upward and forward or downward or backward. And while growing, the core of the jaw is also rotating in any of the direction. So this is basically jaw rotation, and jaw rotations mean that whenever your bone is growing, it's not only increasing its size, it is the core of the bone is itself is rotating, and that would lead to the development of the low angle patient or a high angle patient. We have a different type of the faces. So we have the long face and we have the short face. So these long face or short face are basically being determined by the different type of the growth rotation. For example, you have these scenario. In the picture 1, you see a brachyfacial, a mesocephalic face. In the 2, you are seeing the long face, and in the picture 3, you are looking a mesocephalic or a normal angle patient. So what are the basic determinant which are leading to the development of a long face, which are having the long facial height, and the other extreme and is a low angle patients. Moving on to let's say you have these kind of faces. This is the dolichofacial. Dolichofacial means that this face height is elongated. Mesocephalic mean it is normal, and brachyfacial means that this is low angle patient. What is happening that you see you have a posterior face height and you have anterior face height. If the ratio is so disturbed that if the lower posterior facial height is smaller and anterior facial height is longer, then it will lead to the dolichofacial faces. And if the posterior facial height is long and anterior facial height is less, then it will lead to the development of a brachiofacial faces. In the brachiofacial faces, you would be having like a flat mandibular plane. Why flat? Because the posterior facial height is greater as compared to the anterior facial height. So that is the reason for the low angle and the brachiofacial faces. And the brachiofacial faces, the mandibular plane would be near to the flat, and in the dolichofacial faces, your posterior facial height would be smaller, your anterior facial height will be longer. So you would be having a steep mandibular plane in the dolichofacial faces. There is another term that is called the hyperdivergent faces, hyperdivergent, hypodivergent. Hyperdivergent means that the divergence is great. What is the meaning, understanding of the hyper? That it is increased. So in the hyperdivergent faces, the posterior facial height is smaller, anterior facial height is high, and the mandibular plane is steep. So the angle between the mandibular plane and the maxillary plane, it is more divergent. So this will be, you will be call it as a hyperdivergent faces, because these two planes are diverging from each other, and this is the hyperdivergent. In the hypo, it's clear from the word that these two planes are not in the much divergent. So the hypodivergent and the brachiofacial faces are those faces who have the greater posterior facial height and a lesser anterior facial height. So now we are going to study what exactly happens which leads to the development of the hypo and hyperdivergent faces.